Anorexia nervosa is the topic of this presentation. Anorexia nervosa, by definition, is 85% or less of the ideal body weight in association with other symptoms, and I'll talk about all those. So when somebody is diagnosed with anorexia nervosa, what type of history is this patient going to present with? Well, most often the patient is female, usually in adolescence, teenager, somebody going through puberty, obsessive or perfectionist traits, fear of gaining weight is a big one. I wanted to also talk about this disturbed body image that patients will often have, even though they're probably completely normal, and other things that can happen in terms of what they've been doing in the past is they might be misusing things like laxatives, enemas, and they might also have very restrictive diets. For example, they only eat a vegan diet or a vegetarian diet, things like that. And then there's comorbid conditions that can also occur, like depression. Those need to be treated as well. So let's talk about the symptoms and the physical exam. So somebody comes in, you've talked to them, you've done the interview, now you're doing a physical exam. Well, one thing that's really important is the BMI. You need to figure out the BMI, and it's really low. Normal BMI, if you remember, is between 20 to 25. Well, people with anorexia will probably have less than 18 kilograms over meter squared. Body mass index. One thing they always tend to mention on licensing exam is their clothing style. The clothing style tends to be baggy. I guess that's a way to hide their, incredible weight loss. Other things that would probably present on, in terms of symptoms, would be fatigue. Patient will be very fatigued. They might have fainted. They probably are very weak. Now, if you look at physical exam, there's a lot of physical exam findings that they love to test on the licensing exams. Something called lanugo body hair. And this is that fine hair that appears on babies. Well, this can start appearing on somebody with anorexia nervosa. They can have sometimes hair loss as well. Another thing they can have is if they've been binging and purging, meaning they've been inducing vomiting, they can erode their dental enamel. And then also you will see on the back of their hands, on the dorsum of their hands, scars because of them putting their fingers in their mouth to make themselves vomit. Alright, let's do the diagnosis. Well, the diagnosis, as you can probably imagine by now, is mostly clinical, history and physical exam and all that. But the lab tests will tell you a lot about what's going on. And those lab tests are the CBC, the CMP, and you can also do a UA, urine pregnancy test, beta-HCG, and then you can do an EKG and a bone density scan. And then I'll talk about what each of these will show. CBC, well, because of the nutritional deficiencies, the patient could be anemic. They could also probably have some mild leukopenia. CMP, this is an important one because especially if the person's been vomiting a lot. When a person vomits, they vomit out potassium, protons, and chloride. They're vomiting that out. So if you do their blood tests, they will be low in these three. So there will be hypokalemic, hypochloremic, meaning their chloride level is low. And if you vomit out protons, you are left with a metabolic acid alkalosis. Metabolic alkalosis. Alright, the UA, well, the UA can show signs of ketonuria, which is a very, very indicative sign of somebody who's just been starving. Beta-HCG, well, first of all, why are you doing this? I mean, somebody has anorexia, they're not pregnant. Well, because one of the symptoms of anorexia is amenorrhea, but the patient has amenorrhea because they're anorexic, not because they're pregnant, so the beta-HCG will be negative. Other tests that you can do is EKG. This can show a prolonged QT, and the bone scan can show signs of osteopenia, or maybe even frank osteoporosis. So now let's get into the treatment. Treatment of anorexia basically involves, there's two components, right? There's the behavior component, the psychological part of it, and then there's the nutritional part of it. The psychological part really is something that needs to involve the family, and something that needs to involve just changing the behavior. There's a lot going on in this teenager, and that needs to be addressed. Quite important. You can't just feed them and think that the problem is going to go away. Nutritional therapy, well, first of all, if they're below 75% of their ideal body weight, they need to be hospitalized, because that's severe. If they're above that, you can try to do outpatient, and the goal is 30 to 40 kilocalories per kg per day. That is a very standard target goal. I guess there's a third component that includes medications, and once these have been addressed. And the medications include electrolyte or nutritional supplements like calcium and vitamin D, but they also can include psychiatric medications such as olanzapine and fluoxetine. And these are medications used to kind of treat the comorbid conditions such as depression and the psychological aspect of anorexia. So I'll finish off with just a brief clinical vignette that kind of goes into this a bit. So you have a 14-year-old girl accompanied by her mother presents to her primary care physician complaining of fatigue, sleeplessness for 6 months. Doctor notes that the patient is quite petite and is wearing an oversized baggy dress. Few physical signs are found. During the exam, the patient mentions how fat she has become. She is weighed and found to be 80% of the minimum weight requirements for her age and height. Her mother is concerned as her daughter has been eating little and exercising daily and seems disinterested in friends. Well, this is a nice clinical vignette about anorexia nervosa. And that ends this presentation.